already in here, welcome. For anyone who's going to watch the replay later, welcome to you too in the future. We're here today with Jenn Pike. You can see she's joining me, and we're going to be talking about using the Dutch test in your practice. She's a wealth of knowledge on this topic. So Jenn is a medical exercise specialist and a functional diagnostic nutritionist, and she specializes in women's health and hormones. So this Dutch testing is well within her wheelhouse. And as I said, she's going to be talking all about how you as a nutritionist can bring the Dutch testing into your practice and why you would want to do that. So I'll really leave it to you from there, Jenn, if you wanted to give a bit more of an introduction about yourself, and then you can jump into anything that you would like to do.
Okay. All right. Well, and I'll also throw it back to you as well, Veronica,
Of
just
course.
in terms of, I know there was some specific questions that people had in terms of like, when is the test appropriate? Who would you use this for? And then I am going to pull up and actually, I'll ask you to give me access to be able to share my screen so I can take everyone through a sample test, because it is, it's a lot of great information to talk about, but there's something different when you can see the visual, and then it's like, oh, okay, I get that. So thank you, everyone. I'm really happy to be here. So I know some of you graduated from CSNN. I graduated from there in 2001. At the time when I decided to go back to school, 2 decades ago, I was working as a strength and conditioning coach. My background, I have a BSc in human physiology and kin. I thought I was just going to work with athletes and do personal training and work in the fitness industry my whole life. And I do, in some regards, still do that. But there came a tipping point for me where, as things were changing in my own body as a woman, I was like, fascinating that I don't know the things that I should know about my own hormones and my own body. It's like I always say, we go and get a better, owner's manual when you buy a Vitamix, or you go buy a car, than you do about the body that you're living in every day. And as I was also starting to work with more women as opposed to men, I was recognizing that nutrition and exercise were changing the dial quite a bit, but there was something deeper that was going on. And so that's when I really started to dive into more blood chemistry. So I originally started to do a lot more learning and mentorship, understanding blood work. And we'll talk about this today because the Dutch is actually something you want to use in conjunction with your client's blood work as well. The Dutch is such a fantastic way to get a better picture of what's going on with the 35 different hormone and metabolites that we measure, and organic acids and neurotransmitters, adrenal picture, but it's one piece of the full picture. And you know this as holistic nutritionists, that the difference between being a holistic nutritionist and someone who just dabbles in creating meal plans is that you're looking at the whole person, whole body, whole life. And it really is a puzzle that you are trying to put together. And oftentimes when you're working with clients, you can come away from sessions feeling like you actually have more questions than you do solutions, depending on what you're working with. So as I was diving deeper into all of this, about 7 years ago, the Dutch test came on my radar, and I had been starting to follow someone who is now a very close friend of mine, and we teach a course together on it, Dr. Carrie Jones. And she was the medical director for the lab, Precision Analytical, that created Dutch. And I had the really beautiful honor of being mentored by Carrie and really learning firsthand. And for me, I went and took this test the first time in 2017. I, was quote unquote healthy, doing everything right. I didn't take it thinking anything was going to show up on this test. For me, I don't run tests with clients that I haven't done myself. That's a big integrity piece for me. I really think you should have firsthand experience and like boots on the ground before you're actually offering something to clients. So I did my first test and the results came back and I was like, whose are these? I was like, what's going on here? Why are there red flags? Why are there yellow flags? Well, and I honestly, I didn't even know what some of it meant, because we're not taught this even in your chemistry classes and phys and biology within the holistic realm. And so you do have to dig deeper. You have to look outside of what your designation is right now for the courses and for the education. And so it was like a clicking moment for me when I got these test results back, because all I thought was, wow, if I am over here, and at the time I was 36, 37 years old when I took the test, And I was thinking, if I take this kind of care of my body and I know what I know, and these are the things going on in my system, what the heck is actually going on with some of these clients who have, and I didn't even have symptoms. And so when you're thinking about who these tests are for, or this test, because there's not just one Dutch test, that's also a great myth with a lot of people. There is actually, 9 or if not 10 tests now within the whole product suite that you can choose from. The most common one is called the Dutch Complete that people will do. And there are dried urinary tests. That's what Dutch actually stands for. It's not a European test. It stands for dried urinary comprehensive test for hormones. And so there are, carbon filter papers that you urinate on. This is a really nice thing for your clients as well, is it actually gets shipped directly to their home. They can do it in privacy of their own house. It's very clear instructions, although I will say that if you decide to offer this test, I would actually record an additional video when you're welcoming your client into this experience, because you have to remember that when you're working with people who aren't feeling well, brain fog is real, overwhelm, stress, panic, and it is unfortunate, but it happens often where somebody won't label the test properly. They do something incorrectly. It wasn't saturated enough. They drank too much water before they did the test. And now those results aren't as efficient as they could be. And it really does, like, your protocol is going to come down to you really understanding the results and the client having taken the test in the right way. And then there's also salivary testing that is part of it as well too, for some of them. Like if you're measuring cortisol awakening response for the adrenals, which we'll talk about that today. Unlike, back in the day, 15 years ago, when I started to do salivary testing for adrenal function and hormones, you had to spit in a vial and it took you forever. Forever. And now what's great is that with these tests, you literally just have a proprietary blended piece of cotton that you put in your mouth for a solid minute, and you chew and chew until it is saturated with your saliva, pop it back in the tube, and now you're good to go. So for some of the women that we work with inside of my company and our clinic within the Hormone Project, we will have them do the urine test and the saliva. And that's going to give that full picture. So I'll show you a couple of different samples today. But for me, it was when I started to bring this in with my clients, it completely opened up the results that I could create for them. Because if you think about the issues that, women are coming to you with, and the test isn't just for women, you can also do it with men. I'll keep referring to women today because my clinic, we only work with women and with their teens and tweens, is that, if you have someone who has horribly painful periods, they have really bad PMS, breast tenderness that is just so painful and uncomfortable, headaches that are happening before their period comes on, they've got skin issues, they are snoozing half a dozen times in the morning, they're really slow to get up, they're constantly looking for stimulants, coffee and sugar and simple carbohydrates and that hit of dopamine throughout the day to keep them going. They have a very difficult time sleeping at night. They can't, they're physically exhausted, but their brain and their nervous system is just going like 200 miles an hour when their head hits the pillow, or they fall asleep, but they're not staying asleep in the middle of the night. And, they're up at that telltale window of like 1 till 4 in the morning. Those could be a lot of the reasons why you would test. Now, you may have different reasons that you choose. What does the acronym mean again? Dried urinary test for comprehensive hormones, DUTCH. So it's spelt Dutch, but that's actually what it means. So you also might run this for someone who is perimenopausal, and there's different things you have to watch for and nuances. So I just want to get a pulse actually of everyone in here. How many of you, or are any of you already using the Dutch test or using blood test or any other type of functional test? Just so I can kind of gauge where everyone is at. If everybody could just write into the chat. So not the Q&A box, but literally into like the chat where you see Jessica had just asked her question. That would be great for me to know. Dutch every year. Okay. Just on yourself so far. Use Dutch plus I work with women 50 plus. Okay, great. And so, Connie, for you, when you're working with women 50 plus, using the Dutch Plus and getting that full adrenal picture. And it's like, everyone always asks, well, who is the test for? And can alt labs on self and family. Done a few for myself, not using yet, never used a Dutch, very new to me. Okay, awesome. Thank you everyone for answering there. So when we're working with women who have regular menstrual cycles, typically the easiest to be able to guide into the test. In an ideal scenario, just like if you are sending somebody to their doctor to get blood work done, or you work in a clinic where blood work is something that's available, we want to be testing a menstruating woman somewhere between 5 to 7 days post ovulation. That's where we're going to get the truest picture of what is going on with her progesterone, because we're not producing progesterone in the abundance we need to unless we have actually released an egg and we've ovulated. We get taught that like our bleed week is the main event, but actually ovulation, having an ovulatory cycle is really important. And so we would want to be, urinating on the strips about 5 to 7 days post ovulation, or 5 to 7 days before the next bleed is going to occur. Now, Connie, when you're saying you're working with women 50 plus, some might still have a period. And by the age of 50, you're starting to have more anovulatory cycles, meaning that you are most likely, even if you're bleeding every month, not necessarily ovulating every month. So you may need to do a couple of things to pinpoint the timing of the test for your client. You might have to have them take their body temperature, basal body temperature daily. A couple of months would really be recommended to be able to pinpoint, are they having these temperature rises, which would indicate they had an LH surge, a luteinizing surge. And that is going to also help us signify whether or not ovulation happened. Understanding more about their cervical fluid as it changes throughout the month. And then you could do ovulatory predictor kits, which are actually really inexpensive, and they can just get at the pharmacy. And they could do those strips to be able to really understand whether or not they've ovulated. And, there's after a certain period of time, if no ovulation has happened, typically if you have someone testing for like 20, 25 days and there's not been a spike, you can go and have them do that test at any time. We're talking like perimenopause and beyond for that. But you just need to know this as the clinician, that when those results come in, you have to take into account that if you see progesterone that is very low, that progesterone metabolite, it's most likely because they haven't or are no longer ovulating. Okay. So what we're looking at in the test is we are going to see total estrogen. So it's measuring 3 different types of estrogen in our body. It's measuring E1, which is estrone, mainly produced within the adipose, within our fat cells in our body, but some other viscera, liver as well too. And then you're going to see estradiol, which is the primary estrogen that is coming from the ovaries. And then you're going to see estriol. And estriol is E3. And this one, normally you'll see this high when women are pregnant, and you don't run a Dutch test on a pregnant woman ever. And if people have questions about like if you would run it on a breastfeeding client or anything like that, we can chat about that as well too. But if estriol is sitting really high, this is actually, you can correlate this back to, do they have gut issues going on? Do they have potentially some liver issues? Do they have detoxification issues? So what's really nice about using your Dutch test is that you get to pull back, take into account your initial intake, their signs and symptoms, how they literally are communicating what is going on in their body, look at their blood, look at their Dutch, and start to look at some cross correlation. What you're not doing when you use any type of functional testing is going directly for causation, right? So we throw terms around like root cause all the time, and you've got to be very careful how you're positioning that with clients, because rarely is there one direct cause when we're talking about hormones. Right? We have to remember that hormones are chemicals in our body, and that they are, literally as we're just sitting here right now, there are so many interactions that are happening behind the scenes. And oftentimes they are producing symptoms as a result of something that's going on somewhere else in the body. So it could be digestion, it could be inflammation, it could be an infection, it could be stress. There's a myriad of other things that could be going on. And then that's why it's showing up in the hormones. When I'm often asked, like, who is the test not for? So I wouldn't be using the test on pregnant women. I wouldn't be using the test on nursing mamas until they have either got their period back, or it's been about 6 to 9 months since they've given birth. Hormones are in great fluctuation in the fourth and fifth trimester, so the 3 to 6 months after a woman has given birth. And the test isn't free, right? The test is going to cost her between $400 and $500, depending, sometimes even more if you're doing additional, add-ons. And so we don't want to just throw this person's money out the window. So there's no point in rushing to get the test done. There's so many other things that you could be working on to support your clients. Now, if someone is on the birth control pill, what you're going to be testing, the birth control pill is a form of hormone replacement therapy. She's not ovulating when she is on the pill. And you're going to test and see exactly what is going on with the pill in terms of her hormones. It will give you information about her adrenal status, and it will help you understand how her body is moving things like the pill and other toxicants out, phase 1 and phase 2 detox. But it wouldn't be the first place I would start with someone who is taking the birth control pill. Now, if they have an IUD, well, again, it depends. Is it a hormonal IUD? Is it a copper IUD? And what is the reason why they are wanting to do the test? So oftentimes there's a lot of foundational things you can do. Maybe they're wanting to come off. Then what I would say is let's actually work to prepare your body, support your minerals, your nutrients, your antioxidants, your gut to get you ready to come off of that contraceptive. And then after about 3-4 months, give it a full season, then you could actually run and do that test. So that's kind of like the nitty gritty on who it is and who it is not for. I also wouldn't have a woman who has suffered from long-standing amenorrhea go and run this test, because if she hasn't had a period for, months and months, years, we don't need to have, there's so many other things she could go and spend that money on to support her health right now. That test is just going to confirm everything being low, which is what we would anticipate for a woman who has not had a bleed in a very long time. Hold on, let me pull this chat up. Would you recommend testing your teenager if they have symptoms, but you don't want to put them on the pill? Yeah, I mean, my oldest, she's 16. And when she had her cycle for the first year, I did the first test on her. I actually test her every year. So she's already had 3 Dutch tests and she's 16. I mean, she's grown up in this environment, so it's no biggie to her. So it is, and the reason why I do like it is that it can give you some benchmarks. And so if your daughter is having some symptoms, headaches, migraines, breast tenderness, PMS, these kind of things, and she's had a period for, I like to see it for at least a year, and there is some type of regularity. That doesn't mean that she's getting it, textbook every 28 days. It means that, most teenage girls, the first few years, it can even take up to like half a decade for them to find their rhythm. They could get a period, every 26 and then like 32 and then 27 and then 34 and then 29, 29, 29, 32. So you're really kind of looking within that week-long range. If you suspect that your daughter may have PCOS, where she is getting maybe less than a handful of periods in a year, the Dutch can be a little bit, it again wouldn't be where I would start with your teenage daughter, because if she does have PCOS and she's not regulating, regularly, I would much rather see you go and do a full blood panel, maybe even test her gut. So do something like a GI map test or, GI 360, something like that, and see what's going on that level. And then you could circle back to doing something like the Dutch for that. Any questions on anything I just said there in terms of like who you would and wouldn't use this for? One thing I'll add in that, we get asked a lot, because in our clinic, one of our functional medicine practitioners and nurse practitioners does bioidentical hormone replacement therapy. And people will ask, well, would I not do a Dutch on that? It's actually very helpful to see how well the body is utilizing bioidentical hormones and how well the body is detoxing. So gut and liver function, and then methylation, sulfation, and glucuronidization into phase 2. So it actually can be very, very helpful for that.
You touched there on a couple of things that we did have questions sent in about. So I just want to circle back around on that point of bioidentical hormone replacement therapy. If a woman is post-menopause, still on some form of bioidentical hormone support, would Dutch be appropriate for that person?
Yeah, it can be. Again, it depends what her reasoning is. Like, why is she coming to you? What is she curious to learn and know about her body? And the other question that we get asked a lot too is, would you need to stop your hormones before taking the test? Absolutely not. I mean, and here's the thing is when you're working with a skilled practitioner, if they know that you are on bioidentical, that is going to be taken into consideration. The other thing is you fill out a lot of information for the lab when you send your requisition in. This is actually like the patient does this. And so the lab is going to report in their summary, patient reported they are taking bioidentical estrogen, progesterone, testosterone, DHEA, whatever it may be. And so, what you get trained on, and Carrie and I teach a whole course on this. We can talk about it later at the end. You get trained on understanding the summary and the results. And then the actual NDs who are doing the reporting in the lab, you're going to see in your client's results and in your own, there's like a bolded black written portion at the end. It gives you a little bit of additional detail. They have to be careful because you're not their client. They don't know, like they haven't done a medical intake or any of those things. But it gives you enough to kind of, get the wheels going on there.
Yeah. And then on the point of the breastfeeding mom who might be looking
Mhm.
at Dutch testing, we specifically had a question about a woman who hasn't had ovulation return. So, and there was some note that even like after a year or even up to 2 years for some women, it can be anovulatory while breastfeeding, especially with multiples was mentioned. So would you still wait the 6 months and then consider it, or are you really wanting to wait until ovulation's returning?
Well, the first thing I would do is actually test to make sure ovulation isn't happening because just because she doesn't have a period doesn't mean she's not ovulating. This is like women get pregnant breastfeeding all the time and they're like, I didn't have a period. I didn't think I could get pregnant. Surprise. Yes, you can, right? So the body's ability to actually for the follicles to ripen on the ovaries and for an egg to be released versus the endometrium, the lining of the uterus to actually thicken and shed are two different situations happening. So one can happen without the other. That's how amazing our bodies are. So I would actually, there's different things like you can do the luteinizing strips. There's also something called temp drop that you wear around the arm. There's the Daisy fertility tracker. There's different things that you can actually use. What I would not be saying to women is that like using your free period tracker app is not going to tell you conclusively whether or not you are ovulating. Now, if I was working with a mom who, didn't have a period for a long time, and then say we did the testing and it was like, nope, you're definitely not ovulating, then I would actually be working on things to support her pituitary gland. Like I'd go upstream. So I wouldn't necessarily do this first. I'd be testing her thyroid fully and completely because postpartum thyroiditis is a real thing. So I'd be doing a full blood panel, full thyroid panel, looking at her minerals and looking at all of that first. And we have to also remember too that when we're working with women, in those reproductive years who do still have a menstrual cycle, even if it's not regular, even if you're working with somebody who's perimenopausal, right? Like I'm 43, I'm not having big symptoms of perimenopause, but my body is in that window. So there could be months that are going by where I may not be ovulating. What you want to be doing is making sure that you are supporting from the ground up and understand that the entire journey for the ovaries to actually like essentially turn over a new leaf, meaning any new regime that you start with a client, if you're putting them on any botanicals, on things like Vitex, on things like DIM, sulforaphane, any of that, it's a 90 to 100 day journey in the ovaries called folliculogenesis. So you need to give it at least a season before you would really tweak or shift anything. And that's important to explain to your clients because 2 weeks is going to go by and they're going to be pissed if they're having, the same symptom. So you just need to make sure that that is really clear. I see a question here. Would it be valuable for women with estrogen-led breast cancer? And if so, when would the best time to do it after treatment and during recovery? So it is definitely impactful for women who have estrogen receptive cancer for sure. Cancers overall, I mean, there's a lot of value out of this test outside of, and you have to remember too, like this is not a diagnostic. It is not diagnosing. This is a functional test that is giving us more understanding and awareness of what is and potentially could be going on in the body. So in regards to cancer, what we see in here is how your body actually manages the hormones that you are producing and how your body excretes them. So when you produce, estrogen, progesterone, testosterone, DHEA, cortisol, insulin, all of it, it's not absolute. It doesn't just happen once, then that's the amount you have, for forever. This is going on all the time. And the body, you produce the hormone, you use the hormone. Now your body tags the hormone, and your body then has to eliminate that hormone. And the body continues to produce new hormones coming in until we hit that point reproductively where the body is like, it has been a blast. It's been great. Ovaries have been showing us, love and support for so long. And then as we go into menopause, then we're getting support from another place. So I would not be testing somebody who is an active chemotherapy, radiation, or even taking things like tamoxifen and things like that that are estrogen blockers. I would be waiting. Now, if someone's been put on estrogen blockers for a long time, a few years after treatment, in the upwards of a decade, I mean, I've worked with some women where 10 years later, they are still taking this medication. Then you can test. Yes, you just need to keep in mind that this medication is also in their body. And then in terms of doing it during recovery, recovery, that can mean a lot of different things. I wouldn't do it when she has, you don't want to be taking this test in a chronic time of, you don't take it when you're sick. You don't take it if you're having an autoimmune flare, because the test is going to show what is happening in your body. So if there's a lot of fires to be put out in the system, you're going to see that in the results. Does that answer your question? Give it a second there for a response. You're welcome. Okay. Do you have any other questions for me, Veronica, or do you want me to open up a sample and kind of take you through?
You might get to this in the sample, but we had a couple of questions about how adrenal health comes into things with the Dutch test. So that may be part of the report that you're going to show, though.
Yeah, so I'll give it a little context before we go into it. So with adrenal health, we're often told that there's no way to, truly measure and test adrenal health. And that's not true. So a functional way is ask questions. Do you get dizzy when you go from lying down to standing, from sitting to standing? If you are doing downward dog, or you bend over and stand back up, are you seeing stars? So that could be an indication that blood pressure and adrenal function probably needs some support. Remember what the adrenal's job is: to respond to stress. They're also, sitting above the kidneys. They're a huge part of what happens with electrolyte, sodium, potassium, mineral balance as well too, and blood pressure. So those are some simple things that you could be asking. Major fatigue, that can be another one. Now, I know we use the term a lot, like adrenal fatigue and adrenal burnout, because people understand what fatigue and burnout is or what it feels like. But that's not actually what is happening in the body. There's a dysregulation up top in the hypothalamus, the pituitary, and the adrenal connection. And so if we were to measure blood, most often, if you're going to go and get your blood work done, it's going to be at one point in the day. Usually it's going to be in the morning, fasted. So you could get this cortisol response first thing when you go in the morning, and that's it. To fully understand what's going on with adrenal production of not just cortisol, but adrenaline, right? Like epinephrine, norepinephrine, you want to see the picture over a 24-hour period of time. Now, some physicians will send their patients home with a jug to pee in at specified increments over 24 hours. That's going to give you a more accurate picture. This is what the Dutch does. You're going to urinate on, you have 5 different strips that you're given for the Dutch Complete. And the 5th one is actually an extra one that only people who wake in the middle of the night to pee would use. Otherwise, most people, you're going to start your test around 5 at night, urinate, take another sample around 10 p.m. at night. You're going to sleep all night. You're going to wake up in the morning. You're going to get up. You're not going to do anything other than literally walk to the bathroom, empty your bladder onto that piece of paper, and then you have one more test you're going to do a couple hours after that. And this is going to help us to lay out what I'm going to show you, which is called your diurnal pattern. Now, your production is only one part. So if we get the woman who says, I had my doctor, draw blood, do my cortisol, it was great, it was normal. Okay, but where was it at the rest of the day? Because maybe you wake up and cortisol is strong and healthy, but you crash in the afternoon. you are wired in the evening. And so if we don't look at each point in the day, we are not getting the full picture. And this is really important as practitioners, because if you are going to go and recommend a product for adrenal support to somebody based on no testing or based on a 1-point test, you have to be very careful, because a woman can describe her symptoms and present like she has adrenal fatigue, and you go give her things that have stuff like ginseng or licorice or, adrenal cortex in it, and that's going to be like an upper to her system. And if you're not looking at the full picture and you don't actually see that she actually does have a peak, it just wasn't at the time when she tested or didn't show up on that day, she could now end up with heart palpitations, and feel like crap. Okay. Other end of the spectrum, you could see a woman's morning cortisol be very elevated and be like, whoo, we need to go in there and like dampen that. And now you give her things that are going to lower cortisol, when in fact she actually is like lying on the floor the rest of the day, and she could be the one who benefits from some of that support. So I do think it's really important. Like, we're talking about the adrenals, which are glandular aspects of the endocrine system. Just like testing, treating for thyroid, you really should understand the values and these numbers of testing for that. So let me pop my screen here. Give me 1 second. I'm just going to make sure I've got the right sample open up. And then I'm going to pull it up here for you. Okay, can everyone see this?
Yeah, looks great.
So this is a sample test that's direct from the lab. This is not a client of mine or a patient of mine, anything like that, okay? So here's what we're gonna note on this. So this is the Dutch Complete. The first page of this test is giving us a summary of what's going on in the body. So this is really just kind of like the Coles notes of everything else that you're going to take the client through that's down below. When you actually get proper training on this, so Carrie and I run a course called Deepen and Decode. It is in depth. It's 16 hours of learning this. So you're like breaking it apart piece by piece. So just please keep in mind that we are going through this in a very short period of time today, and your head might feel like it's going to explode. Understand that if this is something that you are offering or that you were going to offer, you really want this to be like, know it like the back of your hand, right? Like and that happens with practice on yourself, understanding, learning, and researching. So this is a 46-year-old woman. These are the times that she tested at and the date that she tested. So she took the additional strip because she woke up and she peed at 3 o'clock in the morning. So we have to capture that. Okay. So I'll blow this up a little bit here to go in on it. So the sex hormone element, looking at the estrogen, the progesterone, and testosterone, we can see here, see where there's these yellow stars all the way to the left and all the way to the right. Anything that's in the green would be considered to be normal range. Now, what do we know about lab reference ranges? That there is normal, and then there's optimal, and there's suboptimal. So we're not like, oh, look you're at 1.9, which is like right in the green. Everything's fine. Like, you're good. There's nothing we need to support. In an ideal scenario, you would want to see every single dial at 12 o'clock, like right up, like somewhere between, honestly, like kind of 10 and 2. You're like, okay, things are going good. As soon as they start to go out of that window, this is where you're bringing the attention to your client. And this is really where, like, in holistic and functional practices, what we're trying to do is to help our client get in front of a possible vulnerability in their health and their body. And we want to educate them on that. So this woman, she is starting to tip into some pretty low estradiol. Okay, this would be this window here between the yellow and the purple is like the perimenopausal range. And down purple and below is typically menopause, postmenopausal. Progesterone for her is actually doing pretty darn good. Testosterone is okay. There's some things that we could do to support there. When we look at what's happening with her adrenals, okay? So if we zoom in here, and there's another section on this test that goes deeper into it. When I was talking about this pattern, this diurnal pattern, okay, this is taking into account all of the points that she has measured to help us understand what's the cycle, what's the life cycle of cortisol in her body when she's producing it. If we look over here to where you see 2725, and this is her total cortisol production. Now, she's still producing cortisol. She's not producing no cortisol, okay? That's very rare. It's an autoimmune condition called Addison's, where you're not producing any, and then there's Cushing's, where you are producing too much. This woman, just her production is probably not as sufficient as what her life requires from her and what her body needs. So her energy may not be what she's looking for. Her performance working out, her cognitive ability to stay engaged and focused, her libido may not feel fantastic. Her ability to recover may not feel great. She may notice that motivation and like ability to, to stick with it and get up and get going may not be what it used to be for her. And so if we look over here, where it says free cortisol, this actually tells us how well her body is managing, or I refer to it as like budgeting the cortisol that's being deposited into her body each day. She actually manages it pretty well. So she doesn't have a lot of cortisol action that's happening, but what she does, she's working well with it. Like she's a good budgeter of that. Now, this is a warning sign. So when these two dials, see the dial on the right and the dial on the left, when they're starting to kind of move towards one another, my brain right away is like, I want to test her thyroid. I would like to know what's going on with this woman's thyroid. So I want to do a full thyroid panel, TSH, free T4, T3, RT3, and I want to look at her antibodies as well, because this is an early warning sign that the thyroid is starting to struggle a little bit. Now, the other thing is that because she manages her cortisol so well, she might not really be aware at just how low vibrational her nervous system and her adrenals are right now, because she's like, I got it. Like, I'm still good. Every now and again, I get tired, but 7 out of 10 times I'm okay. So this is why this can also be powerful, because you can see it in your clients and they're like, no, I'm just here because of this thing. And you're like, but I see this thing. And they're like, I'm not available to that. When you run functional testing, it's like, you can't make this up, right? Like this is their chemistry. This is their body. So here what we can see is that this first dot of the day that says waking, this is actually not what her cortisol is when she wakes up. Because remember, you're sleeping, your urine is being collected, your bladder is, you're filtering everything, and your bladder is holding that urine. When you get up in the morning and you go take this test right away, that first urination is actually holding the answers to what your cortisol is while you're sleeping. Hers is like a little bit elevated. It's not crazy, but it's just enough where you want to ask some questions like, tell me more about your sleep. Tell me more about your sleeping environment, temperature. Are you waking up restless? And what's interesting is when you see clients who have elevated cortisol in the middle of the night, there's almost always a cross correlation with gut. This is when critters are really active. So that may lead to some different things. And then the second dot here, the morning, this is more representative of our cortisol awakening response. Now, if you really wanted to measure and know exactly what happens in the 2 hours of waking, from the time your eyeballs open to when we want to have like our peak production of cortisol, then that's where you would add on the saliva testing. Is it necessary with every single client? It's not. But if you have someone where you're like, there's something I'm not seeing, and you like just trust your gut as a practitioner, it's not even $200 to add that extra bit on for it. It's like 100 and change, and it could very much be worth it for some of your clients. Now, what we want to see here typically is that from the time we wake to within anywhere from 60 to 120 minutes, that our cortisol production should double. Our cortisol is meant to be the most robust at the beginning of the day. So it's like the sun rises, cortisol rises. So in your body, think of it this way. We wake up, okay? We want cortisol to rise like we want the sun to rise to keep us happy and going throughout the day. As the day goes on and the sun starts to set and it gets darker, this is the moon time. This is melatonin time in our body, okay? And we can see in this woman, she wakes, not too bad. She gets a little bit of a peak. For her, if I didn't know her, I would say probably her morning is when she feels her best. She's like, you know what, once I'm up and I'm going, I'm not too bad. But she crashes in the afternoon, and you can see it here, like boom. So this is important to note. Tell me more about what's happening in the afternoon. Tell me more about what you eat in the morning, because this is where you can start to discover things like maybe she's not eating in the morning. Maybe she's fasting. Maybe her morning is actually, coffee, or, it's tea, or it's like an electrolyte and water and not actually food that she's chewing. Again, if we have a potential thyroid issue, we don't want this woman fasting for long periods of time in the morning. We actually need her to nourish her thyroid. We need to get actual food into her body. And then to get in front of this afternoon crash, we need to have stable blood sugar. So we want to start that within a couple hours of waking. Make sure she's getting protein, fat, fiber, carbohydrates, a really good solid bolus of this, and that she's well hydrated. And this is where you look at this and go, okay, some things to support: B vitamins, minerals, right? Those are going to be like your core things in the beginning to be able to get in there for her. Could she benefit from some adaptogens? Potentially, but you'd be going low and slow. Anytime we bring stuff in like that, you want to, start low and slow, and then you can titrate up. But remember, just like when we're working on the ovaries, when we're working on the adrenals, you're going to tell your clients, like, typically 9 to 12 weeks is that window of what we're looking for, sustainable change. I am like being nice if I say she has a slight eek coming into the evening. She hits the afternoon like I need a nap, and she pretty much stays there until she goes to bed. Okay. So the other thing that you can see that happens in the evening sometimes is her blood sugar may be so unstable coming into the evening that she actually rebounds and dips too low while she's sleeping. The body will wake you up if you have low blood sugar. It's a stressor, and that will signal cortisol to be released in the middle of the night to pull glycogen out of your muscles and your liver to bring your blood sugar back up. So I freaking love the Dutch test for adrenal health. Like, I love it because it's so powerful. And I spend a lot of time teaching women when we're working with them about their adrenals, because this is where all of a sudden it starts to click. And now they're like, and a lot of them will get emotional because they're like, this isn't in my head. This is actually happening. What you're describing is exactly how I frigging feel. And it actually gives them a sense of relief, because it's like, all right, I can now see the areas I need to support. Now I'm going to give you another thing here as well. Look how low this woman's DHEA is. This is another indicator that her adrenals need some support. Now, as we scroll on down, so how the test works is like every other page is where like the visual graphic information is. Again, we do not have enough time for me to like literally tutor you on the whole test. So I'm going to go to page 3 where you get into looking at, and I have to zoom it all the way out so you can see the whole thing, and then we'll go in. So this page is where you'll spend honestly the majority of your time with clients breaking it down, because you're going to be looking again at adrenal hormones, like her overall DHA. Now remember, this is the sulfated form of DHEA. So when you're doing blood tests for DHEA and then urine, it's great to be able to have both, because you can cross correlate between the two. If we see somebody who's really, again, low here, I am like, thyroid, please let's go and look at your thyroid. And for some of you, if you do things like HTMA testing, like hair trace mineral analysis, could also be a beautiful addition to this as well too. And then we want to see, like, how is she actually metabolizing her androgens, right? Down the 5-beta pathway, or the more metabolically active 5-alpha. Now, metabolically active might sound good to you, not so much in the body. If she's moving things down more this 5-alpha pathway, which she is, this is going to increase oily skin, hair loss, acne, and also from a like constitutional perspective, fiery. Like, this could be the person who, they go from 0 to 200 in like 1 second, and this can shift over time. And so what happens is, if you are sending more things down that 5A preference, you are converting something called 5-DHT, which is so much more potent than testosterone. So this is a big part here. We can look at progesterone overall. This is a big one for your women who suffer from really severe PMS in terms of their mood and PMDD. When we're looking at progesterone and we're looking at B and A pregnandiol, this is working on the GABA receptor, which is a neurotransmitter to the brain. It's calming, it's soothing, it is the parasympathetic nervous system. If she is sitting very low here, this could be a big part of why her mood is not feeling stable throughout the month. And this would be the difference of giving somebody something, that is just like an adrenal upper versus actually nourishing with some aminos and some neurotransmitters. If you have somebody that has low melatonin, which melatonin we don't want to just think about for sleep, it's like one of your body's main antioxidants that we need. You wouldn't just give somebody who had a low progesterone picture melatonin, you'd want to probably give them some GABA and L-theanine with that. Right? So there's like a whole way of prescribing based on this too. Excuse me. And then if we look down here at her estrogen, it's low. So she's probably going to have, maybe some hot flashes, vaginal dryness, maybe, painful intercourse, dry skin, like things are changing. She might be finding it more difficult to build and maintain lean muscle mass, even though her testosterone is okay. Estrogen does play a role in that as well, too. Now, the other thing I want to point out here is that, remember I was saying estriol, E3. So this is her highest estrogen out of all three, okay? This would indicate to me that we do also want to take a look at what's happening with her gut health and with her body's ability to detox. Because if E3 is elevated when you are, perimenopausal beyond, and even honestly at any stage, and you're not pregnant and there's no other reason why, like you're not taking hormones, typically there is a gut inflammatory connection going on here. And this right here, where you see the blue, the red, and the green, these are the three different pathways during first pass, which is liver and gut, of how we break down our hormones. So again, remember I said you make hormones, you use them, and then your body tags them. Now it has to break them down into something water soluble and filter them the right way to then get bound up and protected to get out of your body, which majority of them are going to go out through your fecal matter, your poop, some out through your sweat, right? Through the skin, filtering organ, your urine, respiratory, but majority of it is going out through the fecal matter. So if we look here, she's actually not doing too bad in all three areas. Her 16 hydroxy, when this is really elevated, this is a big one for women with a lot of breast issues. So fibrocystic breast tissue, cyst, painful breast tenderness, migraines can be seen here as well too. The 4-hydroxy pathway, this is known as the quinone pathway. It is, of all three, we would want as little as possible going down here. This is known as more of a carcinogenic pathway. And so this is where, if left unattended, there can definitely be some denaturing that happens on a DNA level. So things like oxidative stress. And then the 2 pathway, I always say, like green is for go, get out. This is like the healthiest way for our body to actually be able to move estrogen on out. But we need certain minerals in order for these things to happen. So we need to support gut health. We need to support our liver health. We need to think about things like magnesium, B vitamins, potentially some selenium. NAC is beautiful as well to be supporting this. In some people, they may need glutathione and NAC, or you may, alternate between, because we need these minerals in order to support phase 2 detoxification, which is where the COMT enzyme comes in. Genetics can play a role in this as well. And this is literally where your body now is like, okay, liver and gut, thank you so much for breaking it all down. Now, our job down here in phase 2 is we are going to pack it up. We're going to bubble wrap it. We're going to put it in a box. We're going to tie it with a bow so that none of you can escape and go re-up and be absorbed up top. And then we're going to ship you out. What happens in a body who's missing any of those links, who's under a tremendous amount of stress, has high levels in the gut of beta-glucuronidase, where it's just essentially taking the bow off. This little bugger goes in and like opens the box and is like, be free. And all the toxic estrogen compounds go back up top and recirculate. This can create a gong show in the body. This is why pooping is like literally ground zero for our health overall, especially our hormones. If your clients aren't pooping well, this is the thing that you want to be starting to work on, is drainage and elimination before you go up top and start stockpiling them with a bunch of stuff. Can they break down the food that they're chewing? Can they absorb nutrients? Can they eliminate? Big things. Okay, and then as we scroll on down, this goes deeper into looking at what is going on with her actual adrenals. We do test for melatonin in the urine as well too. And here what you're actually seeing is her body's preference between cortisol and cortisone. So cortisone is like the shadow of cortisol. It is there, and the kidneys will actually be who determines how much cortisone is coming on the scene. If it's like body, like you're doing a good job, I don't have to overreact. This woman is actually doing not too bad in terms of her cortisone. Her body prefers, it has a cortisone preference to cortisol that could actually bring in some protective, measurement for her. But if we have somebody where their cortisone is just sky high through the roof, which if we left this woman alone, that's what would happen to her, that is a sign that there's inflammation going on. And so it's like she's not producing a lot of cortisol right now. And what she is, her body is trying to come in and at certain points deactivate. Cortisone is the inactive form of cortisol. So again, unlike when we just see it one time in a blood test, it doesn't tell us how the body metabolizes. And that's the single biggest thing about the Dutch test is that, I would never say to somebody the Dutch is more important than blood. I think that they are equally important and they should be moved together. And in an ideal scenario, you'd also be testing poop and you'd be looking at hair. Like you'd be looking at the whole gamut. Right? Here's our organic acid. So this helps us to understand various nutrients, if they're sitting within range, above, below. And as you learn more about the Dutch test, you'll also start to understand that somebody who shows that they have, excess or sitting at the high end range, that doesn't mean that you want to dampen it. And it doesn't mean that that's actually good. It actually could mean that it's insufficient. This is like if you look at somebody's blood work and you go, oh, you're really high in B12, that doesn't actually mean anything just based on that. It could mean that they're not absorbing it in the cells and that they're excreting majority of it. It could also mean that the morning that they went to take their blood test, they actually took B12 or B complex, and that's why it's showing up high. So you really do need to, understand how all of these talk and connect with one another. And then you'll see the latter part of the test is just all of the lab results. And this is where I was saying that they'll give you a reminder as to like what the patient reported. And the other great thing too is that you can go in and see the requisition form that your client filled out. And I will tell you, I'm going to hit stop share. I cannot tell you how many times I've gone in and read that form. And there are things the client has written on that they've never told me. Like in our intake where I'm like, I didn't know you were taking that medication. I didn't know that there was that. So in a nutshell, those are the different things that you can look at with a client. So it's really powerful in your business. I will say as well too, is, it's very hard if you're a nutritionist simply doing nutrition. It is like, and the way it's modeled in school and how you're taught to build a business is really, it's really not helping nutritionists, which is why having groups like this is so important because, you're mainly taught to build it off of a 3-piece model, which is an initial, deliver the results, and then maybe book a follow-up. And when you start to add in and layer the functional testing, not only is it more fun for you as a practitioner, because I literally am 25 years into doing this. I'll do this until I can't read anymore because I'm just a student of life. And it's, you learn with every client about yourself as well, or for your daughters or for your sons or for your family as a whole. So I just think that, having these as continuing education pieces, it's going to keep you on your edge and it's going to teach you how you can actually build out additional profit streams in your company so that you are generating revenue that allows this to be your full-time thing that you love instead of just this kind of hobby that you do on the side.
Love all of that.
Yeah.
So we're getting close to the end of our hour. So for everyone who's on the call live, if you have any other questions, please throw them into the chat now. We'll keep our eyes open there. But I did have, I was going to ask some of these. Thank you, Sabine. I see you in the chat here. So someone, one of our members before this call had sent in the question of if you have a recommendation on how to deal with clients that think the test is too expensive and how you might approach that with your clients.
Yeah, I mean, you know what? We actually only ever get that from Canadian clients. We never hear it from our US clients. And the reason is because in Canada, we just expect everything to be free, covered by OHIP. So it's a mindset piece where, it's not going to be covered ever. That's not going to be something, they're never going to be able to get this from their family doctor. And you have to ask them, what is the cost of you not getting some answers to what's going on in your body? What is the cost to continuing to feel like how you're feeling? What if investing, $400 or $500 gave you this sense of understanding and knowing, and that meant that we could actually collapse time on your healing journey because we could get there faster? If you want me to continue to guess and just keep throwing things at the board, with a blindfold over, I can do that too. But I'm telling you, and you can work with clients as well, where it's then save up for it. Make this part of your healthy journey budget. Okay, so it's start to put aside, if you can put $100 away a month, then, well, you're very lucky, Teresa Dixon, that you had yours covered. You have extended benefits. That's not what I'm talking about. I'm talking about OHIP. So you have extended health benefits, right? So if somebody has that, potentially, not every provider is going to have that. And so it's like, as practitioners, we have to be part of changing this system where everybody expects that everything's going to be covered health wise. We all need to also understand that part of our budgeting for life is for our health, not just for supplements and the food that we eat, but doing proper testing to understand what's going on in our body. For that. So does Dutch educate us, train us, or do we get trained? No, they don't. So I shouldn't say it no like that. They have, so there's no like certification course within Dutch yet. This is why Carrie and I created Deepen and Decode, which is a 16-hour course that trains you on how to actually run and offer the Dutch test. We also teach you how to bring this into your business. And we also have it in there where, because you are a nutritionist, you can't go up and open your own portal with Dutch. You don't have the designation for it. But what ends up happening is that you get given a code that would give your clients $100 off their test when they're using your code. So how it would work is, say, who asked the question? So say, Jessica, you have a client, Anne, that you want to have the Dutch test done. You're going to send Anne your link. Anne is going to go on, she's going to order her test, and you could link this up, make it very simple for your clients. She's going to enter your code. It's going to give her $100 off. They're going to mail the test to Anne. She's going to do the test. She's going to send it back, and they're going to send her the results. You are going to say to your client, Anne, when your results come in, I want you to forward them over to me. Give me the next 3 to 4 days or a week, however long you need to be able to review, and then we're going to book your report of findings session. But do not start to go and run these tests until you know and you understand them. Amen to this messaging. Canadians need to learn how to value investment in their health. As nutritionists, we really need to sharpen our messaging. 100% we do, right? It's like 100%. But again, it's so difficult. Like in school, it's like you're taught about food and nutrition, and it's like the business piece is this, and then the mindset piece and how to like market, advertise, manage these difficult conversations, is a whole nother side of it. So what I'll do here, let me just copy and paste for you. So we actually have a code for you that we put together for this, where you can save $500 off the course that Carrie and I run. So it's NN, like Nutritionist Networking, 500, and that'll give you $500 off the course. If you want in it as well too, you can upgrade and you can go and purchase your own test as well, which I do recommend. And we have this now where the course is evergreen. So you don't have to wait till our next live one, which isn't until October of 2023. You go in and I'll show you as well here so you can see what's so awesome. And we do this for everything that we offer. When you come into our course, you get it for life. So this is like, we have a full membership site you come into, and I'll scroll down, like everything is broken down into modules. It's all video based with us live. We've run this 4 times. Every time we run it live, you get invited back into the group and you get to join us at no extra cost. You get access to every single time we have run this course since we started doing it, late 2020. And then you get to go into our Facebook. Can you even see what I'm talking about here?
No, I was just going to say, are you meaning to screen share?
There we go.
There we go.
Okay, let me go back to the top. So this is our membership site here. And so we have a Facebook group where you can connect, you can ask questions. There's oftentimes people in there who get together and do different case study work as well too. And then you have lifetime access to all of the modules, which are both written and then in video based as well. So we have run this live 4 times, Carrie and I. You have all of it. We take you through detail, slide by slide. If you have never learned from Carrie before in terms of this test, she was with them for 12 years and was part of how this test was actually created and put together. Like, will literally blow your mind apart. Okay. We go so deep into it, and you get every single one of those that we ever ran. And then you get your certificate upon completion that you can submit to whatever your governing body is for your continued education credits, right? So your CEUs for that. But yeah, it is, that level. And then if you're looking for business mentorship as well, there's that in there within the Audacious Woman for it. But it is, if you're working with women, and most of you are, who have health and hormone issues, I definitely think that it is something to consider to bring into your practice, but I definitely recommend. I am not taking clients on personally, Alex, but I have 4 other functional medicine practitioners in our clinic who are, so you could always send me an email and reach out. I only work with people privately now in business mentorship. I went into sabbatical from my clinic after 22 years in May. And yeah, you're welcome. But it is very, very important to understand this stuff. So, again, like I said, just another leg up, not just for your clients, but for you to have that knowledge base. So, thank you for listening today. I know it is a ton of information to try to take in a short period of time.
Yeah, and thank you for sharing it. This is such a widely requested topic. And as you've said so many times, and is so true, there's so much to know about the Dutch test. So obviously not possible to share it all in an hour, but
Yeah.
hopefully for those of you who are here live and for those who might watch on the replay, got some good little tidbits out of that. And of course, this wonderful discount code for the Deepen and Decode. If Dutch is something that you're wanting to integrate more into your practice, that's an amazing offer. Thank you, Jen, for passing that along to our group. And for those of you who are interested in learning more, that would be a great opportunity.
Yeah. And feel free to message me on Instagram. That's like the best way to get in touch with me. And oftentimes I'll just reach back out with a voice note to you and give you some, clarification on that.
Wonderful. Well,
Yeah.
thank you so much for your time today,
You're
Jen, and
welcome.
sharing all of this great information about the Dutch test. Thank you to everyone who was here live to join us and for your questions. And again, thank you for that special offer. That's a really valuable offer that you've put together.
Yeah, you're welcome. Good luck, everybody, in your business. I love supporting practitioners. We need more of you. So keep doing what you're doing.
Wonderful. Have a great night. Take care, everyone.
Take care.
Bye-bye.